Mouth problems are a big issue in all ages of animals. You can get dental disease, you can get gum disease, you can get tongue disease and palate disease. So depending on what species you've got and what breed you've got, we're looking at different problems. So I'll start with the younger animals. So the one thing that we may find with them is that they don't necessarily all lose their baby teeth, which are the deciduous teeth, and then mostly the canines. So the problem with that is if you've got an adult canine and a baby canine together, the roots are fighting for space. You're also getting infection potentially trapped between those teeth because there's no gap as there should be between the teeth. So what we normally do in those situations is we give them time for them to fall out, and if they don't, we would then recommend that they had an anaesthetic for us to extract the baby canines that are left, or baby teeth wherever they are. Going on, as you get older, you're going to get wear and tear in your mouth. Your dog may be a stone chewer, a stick chewer. It may not be, but it may not chew at all, in which case the teeth may get dirty pretty quickly. The calculus or the plaque on the teeth is basically a build-up of bacteria. And what that over time does is it works on the gum line and infects that gum line. The gum will then start to recede and the roots will start to be exposed. You can then get infections around tooth roots, you can get swelling. Mostly it's going to be painful when that happens. And a lot of the time we would recommend that those teeth get extracted. If they stay and you have an infection around a tooth root, what you will find is that infection will spread up and you may get then swelling over the nose or even around the eye, because the infection is just spreading throughout that side of the face. So rather than let that happen, the best way is to look into dental care right from the word go. So always get your puppy, dog, if you get an older dog, get them used to you brushing their teeth, or at least using some sort of oral hygiene gel to try and prevent the build-up of the plaque in the first place. The other things we find in smaller dogs, or I should say brachycephalic dogs, which are the ones that have the very short faces, like bulldogs, pugs, French bulldogs, they will have quite a squashed face, and then they also have a squashed mouth. So they may not have all the teeth in the first place because there's just not space for them, or they will have them, but because there isn't the space, they then get twisted. The teeth will get twisted in their roots, and that isn't an ideal situation. You can then, your teeth are very close together and you can then get the infections again, or food trapped. And if you don't start brushing those teeth right from the beginning, you probably won't be able to introduce cleaning them later on, 2 or 3 years down the line, because they won't really accept you doing that. The other thing that we do see, not commonly, but when it does happen, again, they do tend to be quite aggressive tumours, the cancers of the jaw or of the tongue. We see them more commonly in cats than we do dogs, and like I say, they are normally the aggressive type of tumour, and sadly there isn't a lot we can do about those ones. There are loads of supplements and chews on the market that you can give your dog. I think the main rule is, if you're going to give them a chew, it may work if they actually chew it. If they do 2 bites and swallow it, it's probably not doing anything for their teeth. You also then need to consider that any chew you give them, they are extra calories to their diet for that daily intake. For example, there are Dentastix that I know accountable for 10% of the daily ration of most dogs' diets. So that's quite a lot then that you need to take out of their normal diet in order for them not to put on the weight. The other things you can use would be supplements. So there are supplements that you can put in their food, such as a seaweed supplement called Plaque Off. Some people swear by that and say it's really useful to keep their teeth clean. And you can also get mouth washes for dogs that you then add to their water. Again, they are supposed to help break down the plaque or prevent the plaque build-up in the first place. You do need to be very careful with which ones you're using though, because there are certain ones that have something called xylitol in them, and xylitol is a toxic poison to dogs, so you need to make sure that you're using the right one. The first signs an owner might notice when their pet has a mouth problem is that they may paw at the side of their mouth, they may choose to chew on a different side of the mouth if it's a one-sided issue. And they also might notice a smell, particularly in cats. They get quite strong smells from the bacteria that grow in their mouths. And also salivation, so they may dribble more than normal, or they may dribble after they've had a meal or dribble after they've had some water, that will often smell quite bad as well, the dribble that's coming out. So that will often be why they present to the vet, because of a smell that's coming or a discharge. The other thing you may notice in your pet is that they choose not to eat at all, or they may prefer to eat the softer food rather than the dry food that you're offering them. And you also will find they will be quite sensitive, so they might not want to drink cold water. You may just need to warm it up a little bit if that's making it easier for them to drink.